people need to understand most of our veterans are getting their health care within the civilian community. They are not being properly screened. And in addition to that, I should say this, not all veterans qualify for health services within the VA health system.
Hello, this is Zach with the American Journal of Healthcare Strategy, and you are listening to the Clinicians and Leadership podcast, where we focus on empowering clinicians from bedside to boardroom. Today, we have the honor of being joined by Dr. Ali Tayyeb. Dr. Tayyeb, thank you for joining us today. Why don't you take a second to introduce yourself, tell us a little bit about your experience and your current role and what you're up to today?
Great. Thank you, first of all, for having me. I greatly appreciate it. I am by trade a registered nurse. I have been so for quite a few years, but I didn't always start out as a nurse. I did serve in the U.S. Navy as a Navy corpsman for 10 years. And after that, I decided to go back to school and created a career for myself within the profession of nursing. I am PhD prepared, and I currently serve with a number of different organizations. I have my own LLC, RN Mentor Consulting, and through that, I work with a number of organizations around professional practice of nursing and veterans health, which is where my research primarily exists.
Well, Dr. Tayyeb, we're excited to have you on the Clinicians and Leadership podcast today, particularly to talk about this subject that is just the integration of military personnel back into not just society, but specifically the skills and the value that they can bring to a healthcare organization. And your experience as in the Navy, and as well as working in healthcare, offers you a unique perspective into this topic today. And coming from growing up in a military family myself, there's a unique sacrifice, not just the individual and makes in their specific time of service, but just in doing the things that they have to do and the sacrifices that they have to make and that their families have to make. And so I want to start by saying thank you for your service and for what you've done. We're grateful for that. And as we dive into this subject, I'm really excited to hear your thoughts and your perspectives on a number of things. And so I guess starting off, what are some of the biggest challenges that veterans face when transitioning into society and more specifically transitioning into healthcare careers?
Yeah, great question. So that's really that, as you mentioned, this is really a two-parter. First, transitioning back from military service into the communities where we most of the time have originated from, right? So that transition within itself is quite difficult, and it's been a bunch of research around that, and well documented that as veterans we have difficulty transitioning back, primarily because we have been enculturated into the military for a number of years. Most on I would say probably on average we're looking at about 4 years. Somebody enlists into the military or enters into the military for a 4 year period. There's a whole indoctrination that happens for individuals going into the military. They transition into the military, and they become accustomed into the military culture, right? They get integrated into the military culture. But when it's time to leave that environment that's been reinforced over a number of years, um, there is really no enculturation back into the civilian community, right? We have maybe a couple of weeks that we go through some classes and transition processes back into the civilian community, but not enough for us to say, okay, now I have put aside my 4 years, 8 years, 20 years of service, and now I can easily reintegrate back because it's a completely culture shift from going into the military into the civilian community. So that transition within itself is quite difficult, and especially when it happens we transition into the military during our late teens, early 20s, most of the time. So we have built our identities in the military. So coming out of the military and transitioning into the civilian community, we don't have the same connections, we don't have the same networks, we don't have the same camaraderie with individuals. So that transition within itself becomes quite difficult. And then you have to also look at now what do you do now that you're out of the military? You have gone from having military service. How does that experience and work translate into civilian work? And you also have to deal with civilian community that don't necessarily understand you or necessarily understand your skill sets and what you bring to the workforce. So that's part one of the whole transition issue. As a result, a lot of our veterans uh, self isolate because now they're not fitting in, right? So trying to navigate through that process becomes quite difficult. The second part that I want to mention, as you've asked, is how do we get them to come into the healthcare community, right? Which is a whole another animal. Most of our veterans may not even see transitioning into healthcare as even an option, right? If you look at any kind of transition work, the people that tend to go after our military are like the police department, the FBI, law enforcement type of stuff. Some companies, depending on what your job is, but most of the time, the healthcare industry is not running after the veteran community trying to recruit them in. So the option of even being in the healthcare community most of the time is not even on the veterans' radar. So that's why it's important for us to look. There are programs out there that target the veterans, specifically like medics and corpsmen within the community that try to pull them back in. And if you're already a nurse in the military or a physician in the military, or you're a physical therapist or a radiological technologist, those individuals kind of easily transition back into the civilian community because they already have the experience, the licensing, and so a lot of them, it's not that difficult about translating what they did in the military compared to what they are going to do in the civilian community. The difficult part is for those of us who maybe like corpsmen or medics who have to go back to school to get licensed to come and work, or if you're not even in the healthcare field, and there's a number of colleagues that I have that were in the military that were not involved with anything healthcare related, but came out and transitioned into the healthcare field. But those are not. That is not. That tends not to be the norm.
Well, Dr. Tayyeb, I think it's helpful for civilians to recognize just some of the challenges that veterans face, because that, like you mentioned, there's a sometimes a lack of understanding of what being and serving in the military for a particular individual has looked like, and the strain and the sacrifice that they've had to make, but also that culture that they are now transitioning out of and transitioning back into just American society. The challenges I think that they face is helpful, not just for all of us to understand so we can better show appreciation, but particularly when we're talking about healthcare and healthcare leadership, that to allow your healthcare leaders to better not just address physical medical complaints that veterans can face, but also just to help build a appreciation and be a landing spot for some of those individuals,
Yeah,
like you mentioned, especially as you're transitioning from a high pressure environment, very detail oriented environment, very discipline oriented environment that is the serving in the military. And in some ways the medical field is similar in some high pressure situations and in
yeah,
discipline and very skills oriented positions. And so I'm excited
yeah,
to dive into some of the rest of these topics, and we're going to get
yeah,
into some various topics today, but particularly I want to talk about healthcare leadership, and particularly starting off with discussing some ways that veterans who are now serving in healthcare organizations can be empowered and can be encouraged to speak up, and address some of these transitioning issues that they're facing, or even just bring ideas to light on how to better improve and run an organization. And so what are some ways that healthcare leaders can ensure that the veterans that are serving within their organizations, that their voices are heard and valued within decision making processes?
yeah. I think from my perspective, once a veteran is in the healthcare system, uh, I think it's important for organizations to realize the skill sets that that veteran brings to the table, right? Because they've already had a number of years in the military, and if they've done about 4 years, we'll say minimum, they've done 4 years. That 4 years has already they've already been through leadership roles. They are already well disciplined individuals. They are going to already be goal focused individuals once they're given a goal to go after. So that's one of the things that we look at from an organizational perspective. But most organizations aren't looking at veterans. Yes, like on the applications that we get, like it says, "Are you a veteran?" and it's a check mark. And organizations get brownie points for that, for hiring veterans. What organizations tend not to do is invest in the veterans afterwards, right? Like they're in the system, fantastic, you're in the system. I call it the badge buddy effect. I don't know if you've seen like hospitals who have the badge buddy, and the badge buddy says like veteran on it, or it says United States Navy or United States Marine Corps veteran, something like that. I call it the badge buddy effect, right? Or you get the veteran into organizations, you slap on a badge buddy, thank you for your service, and that's the extent of where they stop engaging with the veteran, right? They've hired them, they've done their good deed. We appreciate that. We always, love organizations that actively recruit veterans. But what do you do with the veterans afterwards? How are you investing in them? And how are you investing in your own organization in ensuring the organization understands the value of the veteran that is in their organization? And that could be as easily done as, for example, creating an opportunity for the organization to learn about the veteran culture, right? Because it is a different culture, right? So how do we become culturally aware of what the veteran culture or the military culture is? Because if I don't understand the veteran culture or the military culture, I may take things the wrong way. And I'll be the first to say I've gotten in trouble more than once and ended up in HR for, saying something where in the military it would have been completely normal to say, right? Or sort of sometimes, discuss. I even from discussing my military experience, I've had people be I want to say there's a stigma behind sometimes being a veteran, right? Because of what you have experienced and the things you've been through. So people don't necessarily always know how to react. So just by me sharing my military experience with a colleague who asked about it, I got a call from HR saying, "Hey, somebody didn't know how to exactly take the information." I'm like, I was just discussing something that I was asked, right? So something as simple as sharing military experience can sometimes make people uncomfortable, right? So the organization, and that just basically means the people that are working in the organizations don't understand military culture, don't understand how we interact with people. Like in meetings, I could be loud and use my hands. I love using my hands to begin with, but some people find that like aggressive, right? But it's not because it's you're passionate about a topic and you're going to be talking, but some people would find it aggressive. So some of those nuances, which is completely normal in the military culture, doesn't translate well in the civilian community. And when I was leaving the military, nobody said when you're sitting in a meeting, don't use your hands, or don't raise your voice. Not shouting, but just raising your voice from like being passionate about a topic or something like that. Like a lot of these nuances that they don't talk about, and then you compound that with being, for me anyway, I'm in the nursing field, being in an environment which is predominantly female, coming from a predominantly male population. There's also those challenges of how do we start interacting, because how I was working with my male colleagues is much different than how I work with my female colleagues, right? So there's also those things that go into play, and there needs to be some education, not only for the veterans, but also the rest of the community, because the burden can't be all on the veteran, that they have to change who they are, right? To make themselves safe for other people, right? So other people can feel safe, right? Like asking the veterans to change who they are so others can feel safe, because there's so much stigma behind who veterans are, what they are, what they do. So a lot of misunderstanding in the civilian community to begin with.
Right. Well, and I love what you said, and when you described it, just the value that a veteran brings, and how
Mm,
that's a critical component um, for someone who is serving in a healthcare leadership position to be able to recognize that. And
yeah,
there's a massive clash of cultures, like you just walked us through, between someone that's been serving in the military and has has adapted to that culture, to then someone that is serving in a different capacity in a different industry. And
yeah,
there's always a clash of cultures, but particularly when you're interacting with the military, that is a big clash of culture. And to, like you, I love to also how you describe, just to put that burden to change solely on the veteran, after that they have spent, on average 4 years, regardless number of years,
yeah,
serving in some pretty intense roles and some pretty intense situations, and regardless serving the country, to then put additional burdens on top of them as they're trying to integrating, is a hard thing to do, and
yeah,
does not convey the value that they bring to the table. And I think that's such a critical thing, that healthcare organizations and healthcare leaders can really step in. And so,
yeah,
um, beyond hiring, how can healthcare organizations cultivate a culture of appreciation and respect, both for just for veterans in general, both the employees that have served, but also for the patients that are
yeah.
veterans coming in? How do you create a culture of appreciation and respect for those individuals?
Yeah. I don't know if it has to do with a culture of appreciation or respect. Um, I don't think anybody, or there aren't that many people out there that are not necessarily respecting our veteran community. I think the issue is the number of veterans we have now compared to, well, right now we have a number of, when I first started researching the veteran community, we were somewhere around 23, 24 million veterans. And then by now, we're down to about 18-ish million veterans. And that's because a huge number of World War II veterans have since passed. Our Korean era veterans are up there in age. A number of them have passed. So we have a declining number of veteran population to begin with. In addition to that, we have a much smaller military than we did, like let's say back in, let's say, World War II, right? Just because and I say that from a perspective of there were so many people that had the military experience. I didn't have to explain myself back in the day about what military experience was like, because more than likely a number of my neighbors and people in my community or my coworkers also had those same experiences, right? Which is different than now, because only a very small percentage, and I want to say from an active duty military perspective, it's like less than 1% of the population, right? So the percentage of the people that are either veterans or active duty is extremely small. So the idea that the general population in the US understands who veterans are and what they do, is the gap between this, what they call the civilian military divide, continues to grow, right? Because we're less exposed to the population. So that's one thing. So I don't think there's people who may not necessarily respect. It's just that we just don't know, right? And if we're not exposed to it, we don't ask the question. The curiosity about the veteran and the military community just isn't there unless we're actively in a war. Then the media hypes us up, and then you start getting some press releases, and all of a sudden people become military or veteran aware. So other than that, when it's not in the media, when it's not on the socials, uh, the veteran community kind of fall aside to the side of everybody's thought. It's not actively there because, again, that interaction isn't there like there used to be. So that's one issue. I think the thing that healthcare organizations can do in general is take an active role in not only understanding military and veteran culture, but how are we integrating their healthcare, right? Because they have a very specific and unique healthcare needs that need to go into into our civilian healthcare organizations and institutions. Most veterans do not receive their health care within the veterans health system, right? They're not getting their care at the VA, they're getting their care in the civilian communities. However, most of our civilian communities or healthcare organizations, what they are not doing is they're not asking the right questions. They're not asking the veterans who are coming into their system, or even families of veterans, families of active duty military personnel, some active duty military personnel that use our civilian communities, healthcare systems. They're not asking the questions of, have you ever served in the military? And if that question is not there, they are not doing any of the appropriate follow up assessments that go along with that, because veterans have various uh, um, mental health issues, right? That need to be, well, they don't all have it, but they need to be screened for. Any kind of physical issues that they need to be screened for, any kind of exposures that they need to be screened for. So there's a number of things that we miss on the civilian community that is very specific, that we need to be asking about those military experiences.
Yes. Well, I loved how you described that, and just the intentionality behind engaging these veterans, both employees and patients, and asking them that simple question. That's an easy question to include in an assessment. And is, have you
Right.
served in the military? That can help guide a differential, but or guide screening exams as
Yeah.
well, and just the proactive benefits that brings from engaging those individuals. And
Yeah.
just the challenge I would imagine without that, of you have individuals that have served within the military, like we already mentioned. It's high pressure situation, not a lot and then transitioning to seeking medical care. Being in a medical facility is inherently a vulnerable position for a lot of these people to face. And so if you're not engaging them with just in simply asking them if they've served, you're missing out on an opportunity to provide the best care that you can to a
Right.
group of patients that have spent, a portion of their career not being able to be as vulnerable, as maybe some other individuals who are
Yeah.
just in society. And so, and you've touched on a couple of those ways, and we've just highlighted that. But I'm curious, from a leadership perspective, how can leaders within healthcare identify gaps in their healthcare system that make it difficult for veterans to access the care that they need?
So we're not going to talk about the VA system, because the VA system is, that's what they do, and they're good at what they do. But it's the understanding that, not all veterans are accessing. Most veterans are not accessing the VA health system. Most veterans are accessing the civilian community because they have their own health insurance or what have you, right? So they're accessing that. In addition to that, they are also not. Most organizations, I guarantee, have this gap, right? Because again, we're not teaching our schools of medicine, nursing, what have you. We're not teaching them anything about the veteran communities and any kind of related illnesses or issues. We're not asking the questions within the healthcare organizations, and very few, I would say, organizations outside of that are actively engaged in making sure that they are um, cutting out a niche for the veteran community within their conferences, education, and things like that. So, unless you're actively going after some of this military specific or veteran specific continuing education, you're not getting it anywhere else. The organization isn't asking the question. And if you're not asking the question and you don't have the educational background to understand, okay, now that I asked you, have you ever served in the military? Now, what do I do with it? Right? Because if I don't have the background and the knowledge and the education on it, I can ask the question, I put a check in the box, but then I don't know what to do with it, right? And that's problematic, right? So that gap definitely exists for, I would say, probably 99% of the civilian institutions out there, that they're not, they are, they don't have the education, they don't have the competency to actually provide the best care for our veteran community. And that's just the reality of it. And hopefully, that's one of the things we're hoping to change as time goes on. And that's where some of the organizations, um, within not only the military community, but some organizations within the civilian community, that are cutting out niches to create that specialty within the civilian community, is that much more important.
Well, and Dr. Tayyib, I think it speaks to the importance of as well of having conversations like this and creating content like this and just individuals like yourself that are championing the just what it looks like for organizations and for individuals to help veterans in this transition process, both into society, but also serving in healthcare positions. And so thank
Yeah,
you for your passion and for your work in doing so. And like you said, experience is such a big part of understanding how this transition works, some challenges that
yeah,
individuals face, and how to better and best assist other people going through those same challenges and transitions. And so
yeah,
we're grateful for individuals like yourself that have done this, and are doing this and are championing this for others. And so before I let you go, Dr. Taib, I for our listeners, I want to hear what is one immediate action that a healthcare leader can take today to better support veterans in their workforce and in the patient populations that their healthcare organizations serve. What is something that a healthcare leader can do or to implement today that would encourage and better the veterans in the workforce and those patients that have served?
yeah. I think I get that question more than you would think, and over the years, as people have asked, I've changed my answer. But I think the best thing, because I always have like, oh, you could implement this or you could implement that, but I think it really comes down to really one thing: make the veteran community a priority within your organization, not a competing topic with everything else within the healthcare system, but making them a priority. They don't have to be the number one priority, but as you plan anything moving forward, right? Whether it's healthcare, whether it's a documentation system, whether it's continuing education, whether it is whatever you're going to do within the organization, making sure that you call out the veteran community specifically, and making sure that you are making them a priority as you implement anything new. If you're trying to refine anything, just make them a priority, because they have always been a priority. But for some reason, over the last, I would say, couple of decades, although as the wars have sort of like not covered as much within the media, we are moving away, and they are becoming this other thing, and they're no longer, they are, from my perspective anyway, I'm going to say, they have become less of a priority for many organizations, because it almost feels like I always call it like the flavor of the month. The veteran community can't be the flavor of the month, right? We have been the veterans have been serving the from its inception. The veterans have been serving and sacrificing and giving their lives for the country. I think as a country, we owe them that responsibility, that they continue to remain a priority for anything we do within the healthcare system. And I think part of it is, again, has to do with the fact that we continue to think that they are getting their healthcare not within the civilian community, but within the VA system. But people need to understand, most of our veterans are getting their healthcare within the civilian community. They are not being properly screened. And in addition to that, I should say this: not all veterans qualify for health services within the VA health system,
Mm,
right?
right.
So keep that in mind also. That, again, making them a priority in anything we do, I think, is a great first step. And then the conversations to follow after that will just fall into place.
Yes. Yeah. Well, and I can't imagine a better way to just encourage just engagement with veterans, then and to encourage not personal but organization wide, seeing these individuals with this experience and have service to our country as valuable, than making them priority, than just
That's
straight up valuing them. And so I think that's a very good key theme for individuals, in leadership across the country, but
yeah.
particularly within healthcare systems, to keep in mind as they're doing this. And so,
Yeah.
Dr. Tayyib, thank you for joining us today on the
Thank you. I
Clinicians
appreciate it.
podcast, and for sharing your insights, onto this necessary topic that is very prevalent, and will continue to be very prevalent going forward. And so we're grateful for your time today, and we wish you the best going forward.
Great. Thank you. I appreciate the time.